So just how should you take oral iron supplements for restless leg syndrome? I'm Dr. Andy Berkowski of ReLACS Health, and today we're going to talk about the best way of supplementing iron as a treatment for restless leg syndrome. Because of low iron levels in the brain, the body of someone with restless leg syndrome is very sensitive to the body's levels of iron becoming low. And oftentimes, aggressive supplementation is very effective. In fact, iron supplementation is a first line treatment for this condition, and this can be done without medications with iron supplements. But the question is how to supplement. You can't just go to the store, get a supplement, and say, hey, I'm taking iron. It really helps to look at your own iron levels. If your ferritin level is less than 50, and your transferrin saturation is less than 20%, you may benefit from a full dose of iron. This should be done once daily, and you probably should take around 40 to 60 milligrams, give or take, of elemental iron. The formulation may not matter all that much, but the amount does matter. The more iron you take, the less likely it is to be absorbed. So 40 to 60 might be good for those levels. Now, if your ferritin level is, say, between 50 and 75, you've got sort of low normal ferritin levels for restless leg syndrome, you may want to try something like 15 to 25 milligrams of elemental iron. It should not be taken with meals. There was a study about 15 years ago that looked at people who took 50 milligrams of iron per day, and it turned out only 2% of that iron was absorbed with food. 9% was absorbed on an empty stomach. So it's very clear that iron should be taken on an empty stomach, but not everybody tolerates taking iron on an empty stomach. So that's really the trick. The other thing is it should not be taken more than once per day. In fact, many people would do even better on a high dose of iron taken every other day. The reason for this is because of a feedback mechanism by a protein called hepcidin. After somebody takes an iron supplement, the hepcidin protein rises in the bloodstream and it blocks the ability of the body to absorb more iron. It's sort of a safety mechanism to prevent having too much iron. And if you take iron twice in one day, the hepcidin will block the second dose of iron from getting in. So it's better to take it all at once, generally once a day. And because we think iron levels typically drop at nighttime, it might be better to take it at nighttime on an empty stomach for restless leg syndrome. Again, this video is for general informational purposes only. It does not constitute the practice of medicine. All decisions about iron supplementation should be made under the supervision of a licensed medical professional. And as I sometimes remember to say, one of the keys to sleeping well is to relax.